Welcome. If you're navigating your healthcare options right now, you probably already know that Medicare can honestly feel like learning a totally new language. But today, we're going to cut through all that noise. We are focusing on exactly what you need to know to protect your financial future. I'll be your guide, and we're going to walk through this whole thing together, step by step. Okay, let's dive right in. So, Original Medicare, which includes Part A for your hospital insurance and Part B for your medical insurance, it's a really fantastic foundation. It gives you the total freedom to see any doctor or visit any hospital in the U.S. that accepts Medicare. But there's a massive catch here that catches a lot of people completely off guard. For Part B covered services, after you meet your deductible, Original Medicare generally only pays 80% of the Medicare approved amount. That leaves a pretty significant gap. And you really have to ask yourself, what happens when it only pays that 80%? Who exactly is responsible for the rest?
Well, you are. You're on the hook for that remaining 20% coinsurance. Now, 20% of a routine doctor's visit, that might just be a few bucks. But 20% of a major surgery or ongoing treatments or some really expensive outpatient care, that can add up incredibly fast. So the absolutely crucial point here is this. Under Original Medicare, there is absolutely no yearly limit on what you pay out of pocket. No limit unless you have supplemental coverage, your financial exposure is technically limitless, and that 20% gap, it's a financial vulnerability you simply cannot afford to ignore.
So, Section 1, the safety net, Medicare Supplement. How do we actually build a wall around our retirement savings?
We do it with a Medicare Supplement, which is often called a Medigap policy. Basically, these are standardized insurance policies sold by private companies. Their entire purpose in life is to step in and help pay for those remaining healthcare costs that Original Medicare just doesn't cover. We're talking about bridging those financial gaps for you, the co-payments, the co-insurance, and the deductibles. Once Medicare pays its approved share of your healthcare costs, your Medigap policy swoops right in to pay its share. It really acts as your financial shield, giving you the predictability and the peace of mind you absolutely need.
Moving right along to Section 2, the sweet spot. Let's do a deep dive into Plan G.
Plan G is highly regarded for a very good reason. In fact, it is the most popular plan selection out there right now for new enrollees. It covers 100% of your Part A hospital coinsurance and hospital costs up to an additional 365 days after your Medicare benefits are totally used up. It covers 100% of your Part B coinsurance, it covers 100% of your skilled nursing facility care coinsurance, and 100% of your Part A hospice care. Honestly, Plan G covers almost every single gap left by Original Medicare. Literally, the only thing it doesn't cover is your annual Part B deductible. Once you pay that one small deductible for the year, Plan G steps in to cover 100% of the rest of your covered medical gaps.
Let's put some real-world numbers to this so you can see exactly why this matters so much to your wallet. If you are hospitalized, Original Medicare requires you to pay a Part A deductible, which is $1,676 in 2025, and that's each time you start a new benefit period. That means you could potentially pay that nearly $1,700 multiple times in a single year if you happen to be in and out of the hospital. But with Plan G, that $1,676 deductible is covered at 100%. Plus, Plan G also covers 100% of Part B excess charges. Those are the extra sneaky fees some non-participating doctors might charge above the Medicare-approved amount. You are completely insulated from those surprise costs.
But picking the right letter is really only half the battle. Let's look at Section 3, the standardized delusion, or what the letters don't tell you.
Here is the big secret. By federal law, these plans require rigid standardization. A Plan G from Company A pays the exact same medical benefits as a Plan G from Company B. 100% identical. If you go to the hospital, the coverage is the same. If you see a specialist, the coverage is the same. They all have to follow the exact same rules. Because of this, it's incredibly tempting to just go online, look for the company offering the lowest possible monthly premium on a Plan G, and just click enroll. But doing that can be a massive mistake.
Why? Because of the behind-the-scenes reality. While the medical benefits are identical, every company still works very differently behind the scenes. For instance, what's a company's rate increase history like? One company might offer you a super low introductory rate, only to drastically rate you up year after year. Another company might actually allow you to lock in your rates or have a much more stable history of pricing. And what about customer service? When you're dealing with a health issue, the absolute last thing you want is a company that is impossible to get on the phone. You need to know how helpful they are, what they assist with when you have a billing question, and what their specific underwriting practices are. You really have to realize that you aren't just choosing a plan letter. You are choosing a business partner for your healthcare for years and years to come. Trying to navigate these invisible company variables all by yourself is a huge risk. A cheap premium today might cost you dearly with relentless rate increases or terrible service tomorrow. And these aren't just metrics you can easily pull up on some generic government website. They require deep, behind-the-scenes industry knowledge.
Which brings us to Section 4, the advisor advantage. It's time to get some expert help.
Because of all these hidden factors, it is very important to talk to a licensed advisor about your options before you enroll. You want a VIP Medicare resource like Stevens & Associates Insurance Agency. As licensed professionals, they don't just look at the letter G, they look at the actual company behind the letter. They have the contact information, the resources, and the history to know how these companies really operate in the real world. By utilizing an advisor, you ensure that you aren't just getting the right plan, but you're getting it from a company that will actually be a good partner to you.
So, as we wrap up this walkthrough, I want to leave you with one final thought. You now know the risks of Original Medicare, you know the incredible protection that Plan G offers, and you know the hidden dangers of picking a company blindly. The next step is totally up to you. Are you ready to look behind the scenes of your coverage and make an informed, confident choice for your future? Don't leave your healthcare to chance. Reach out to a licensed advisor, ask the tough questions, and take control of your Medicare journey today.